Hi, everyone. Thank you so much for joining us. We're back with a new episode, and it's going to be very exciting today. I have Jessi and Lauren here with me. Hi, ladies. How are you doing today?
Good. Hi.
So great to meet you. I am very excited. And I guess what would be great is for you guys to kind of introduce yourselves first. Before we dive into the topic and all the things we're going to discuss today.
Well, I'm Jessi Sletten, and I am the owner of Empowering Postpartum. And as a postpartum empowerment coach, I really focus on helping birth givers feel really prepared and nourished and honored through their journey into parenthood. And I do that with working with them through creating really customized postpartum support plans. And we really focus in on kind of their goals and their support systems. And we really look at the picture as a holistic process. And once we kind of figure out what we're dealing with, we can really create actionable plans where they can feel like that they have the most support and the most, just confidence moving into their new parenthood. And this is true for whether they're a new parent or they're a more seasoned parent, which we have Lauren with us today, who is a more seasoned parent.
I don't know if I'd go that far.
Yeah, whatever that means, right? Like, we've gone through it before. I don't know if that means I get an expert badge or anything, but anyway, so yeah, that's me in a nutshell. And I do offer services that are both group program based and one-on-one containers. And I also am a lactation consultant. So I work with folks on infant feeding goals and challenges and education. So that's who I am.
Thank you so much.
Yeah.
Amazing job. It sounds so interesting. Lauren, how about you? Give us a little bit of backstory.
Yeah. Oh, okay. Where do I start? I'm just kidding. Hi, I'm Lauren Haxby. I am a mom to a fiery little redheaded 3-year-old named Maeve. And I'm currently almost 19 weeks pregnant with my second, also a girl, we found out this time. And I am a labor and delivery nurse, and I work in both the hospital setting and the birth center setting. And I'm really trying to focus on kind of changing the birth culture towards more of consent, not coercion. So I'm really working on helping to create safe spaces for birthing people and hopefully bring a little bit of justice and equality into our healthcare system. A bigger task than anyone can dream of. But yeah, slowly, brick by brick, we'll get there.
Such an important task.
Yes.
And thank you for doing this. So important. Well, I'm super stoked about this episode because Jessi here is going to start by getting some backstory about Lauren and ask some questions, and then we'll go through the coaching process kind of step by step. So I'll hand it over to you, Jessi, and yeah, please walk us through and show us how you kind of do your magic to prepare new parents.
Absolutely. So again, we talked a little bit about this before the recording, but this is a huge, vast topic. So a lot of times I work with folks anywhere from 3 months to 6 months on really just supporting them through preparing and then through actually implementing once baby is here. So of course, this is going to be kind of a little tiny snippet of really like the work that we can get into. But talking to Lauren ahead of time about this, she really identified 2 key areas that she really wanted some support in. And that included just really understanding her nutrition and how that can impact her journey now and once baby arrives. And then also just really being present. And that's a really important piece. And it's really special in my heart too, because that's where I struggled really badly with my first birth. And my first postpartum experience. And so that's been I would say one of my biggest passions with the work that I do is really trying to ensure that we have a solid mental health self-care plan that really can allow that presence to be there so that you feel like you're not dissociating from your your parental experience. Like that newborn phase can be so challenging in so many ways. So with that being said, I would love, Lauren, with whatever you're comfortable with sharing and feel called to kind of give us some information on that experience with your first birth and pregnancy, and really where you felt that distance of not being present, and what you think might have contributed to some of that for you for your first experience.
Yeah, for sure. So with Maeve, I was seeing an OBGYN group which was my first mistake. Midwives all the way, man. And it was interesting. My whole pregnancy, I had kind of an elevated white blood cell count, which is normal in pregnancy because our bodies are responding to the, incidental state of pregnancy. Mine were just kind of like very elevated. So we just kind of kept an eye on it and we're like, are you sick? And I was like, no, I think I'm fine. Fast forward to, I was 39 and 5 and I was in the office and they were doing Doppler tones and her heart rate had dipped down pretty low. And being a labor nurse, I was like, no. So I opted for an induction that day because I didn't want to go home and worry about, what was going on. That was my second mistake. So I ended up getting induced. I think I was already like 2 centimeters when I got there, which was great. But then, the process of all the interventions and all the medications. And then of course I opted for an epidural because why wouldn't I? It's available and readily there. So did that. And then just that's kind of, I think, where I first started having that issue with dissociation was because I'm coming at it from such an analytical point of view. And I'm coming at it from such I was like, can I watch my strip the whole time? And I would like turn myself in bed and my leg would fall off the bed. And then I'd have to call my nurse and I'd be like, I'm sorry, I moved myself and I did it a little too much. And now my leg's off the bed. Can you come help me?
I can't move it. Could you
I
lift
can't
it up for me?
I flopped myself and I found my baby, but I just need you to come help me with my leg. It was very much like I'm going to take care of myself situation, which is just, kind of what you have to do in the hospital anyway, which is super unfortunate. But I ended up with a pretty easy delivery. I was induced 6 p.m. or whatever at night. And then I didn't deliver until 5 o'clock the next morning. So I got no sleep because I was just awake and on adrenaline. And so that was a big part of it was I was so exhausted. And I also delivered in May of 2020, which was like the height of COVID. So everybody, there was even a talk at one point of if your support person was going to be allowed in the delivery room. And thankfully I have connections. So I was like, I will literally sneak my husband up the back staircase if I have to. It's not an option to not have my husband here with me.
Right. So real quick, I don't want to interrupt you, but the hospital, it even, they were even using that for like partners. It wasn't just like a second or a tertiary support person, like a doula. It was like, you may not have your partner with you.
No. So Colorado was still fine.
My God. Yeah. I thought so.
But there was
God, that's horrible. There was like 1 or 2 hospitals though. That was really it
was pretty questionable. And they were super strict and you couldn't come and go.
Yeah.
You had to stay in the room the whole time. And then if you had COVID, they did not allow your support person in there whatsoever. So you were alone. If you had COVID and you were a pregnant person trying to deliver during the pandemic, you had to do it alone. Incredibly sick, which just
horrible.
Still baffles me. No, because New York was doing that where they weren't allowing support people in. And so there was, a lot of commotion and talk, especially on my internet groups of the, May bumpers. Everyone was like, do you think we'll have our support person? So thankfully my husband was allowed in, but then, and it was a quick, pretty easy, simple delivery. I didn't push for very long. I think I just had a normal 2nd-degree tear. But their thing was they were pushing people out at 24 hours because of COVID. So not only did I not get the lactation support that I needed, and it was one of my big goals to breastfeed. But then, dazed, tired, dumbfounded, because I'm really good at getting babies out, but once they're out, I'm like, I'm just gonna,
what do I do?
Take this back now.
Yeah. There you go.
And they all kind of just have this expectation that because I was a labor and delivery and postpartum nurse that I would be fine. And so my husband wasn't given a bunch of education. I was not really given any education because I was being treated as a nurse, which is whatever. So we discharged at 24 hours. I saw a lactation consultant once and she was just not very helpful at all. And so then we went home and I was definitely the start of it, dissociating and being extremely sleep deprived. We didn't really have much planned just because of COVID. And my husband, I want to say I was 36 weeks, had a cervical disc replacement in his neck. So he had to go have outpatient surgery and was in a neck collar. So we had a lot going on. And it was COVID. And so, there wasn't a meal train and I didn't have anybody coming over except for my mom. But yeah, day 2 postpartum, I ended up with 103 fever. I had chills. I felt horrible. And I was just rationalizing everything. I was rationalizing abnormal things. Oh, it's just postpartum chills, blah, blah, blah. And then I had this intense abdominal pain that wouldn't go away. And so we left our 2-day-old baby with our neighbors because it was COVID and they weren't going to allow anyone in the emergency room. My husband flew down to the hospital and they found that I was septic, which is like an infection in your bloodstream that can get to all of your organs from endometritis. The lining in your uterus, mine was incredibly infected. And so then therefore causing me to go into sepsis. So I had to, hi, yeah, you got a lot of stuff going on right now. So I had to be readmitted to the hospital for 48 hours for really intense IV antibiotic. And at that point, I was at my home hospital where I had worked. I did not want to deliver where I worked. Hey, can you go see daddy? I know, but I'm doing a meeting. Can you go sit with daddy, please? So 48 hours of IV antibiotic. Thankfully, so they weren't going to allow my husband to come back in, but because I was in my home hospital, they were like, please, you can bring your husband. I talked to my manager. Hey, if you're sitting with me, you have to be quiet, okay? And so thankfully, we snuck Maeve in through a back door because I was like, I will not be away from my newborn baby for 48 hours. Like, sorry, I'm not doing that.
Yeah.
So they snuck Maeve in, but then it was also like terrifying to bring my newborn into a hospital where there's people with COVID, you know, so that was a whole nother layer. But there, actually, I ended up getting the support that I needed for lactation. And I felt so much better. But I still was just kind of like, okay, what's the next thing? Okay, what's, now what? Because I was so sleep deprived. I was obviously incredibly sick. And so I think it definitely was very traumatic for not only myself, but also my husband to see me in that state. And when I first went into the ER, they were not going to let him in. And I was like passing out in the wheelchair. So thankfully I was like, I work here, bring my husband back. So yeah, that was, I think, the beginning of it. And then from there on, I was just kind of in purely survival mode and was just focused on, okay, I need to breastfeed. I need to try and rest if I can, but I also need to try and make sure that, especially first time mom, okay, there's some you feed them and then you wake them up for a little bit and you play with them and then you put them back to bed. And so I was constantly on the internet researching thing after thing. What can I do? What's the best thing for reflux? What's the best thing for colic? And you have all these different avenues of information that sometimes, actually most of the time, are incredibly overwhelming. And so instead of just listening to myself and my baby, she was fine. I didn't need to learn a crazy new method of swinging her and then sitting her upright to Berber. She was fine. But I was just how can I make this easier and better for myself? Instead of listening to that, I was constantly just in the doing phase. Let's do this. Let's look at this. Let's do this. And it was exhausting, which then, just is cyclical and cycles back into the not really being present. So instead of just kind of going with the flow and being oh, look at her do tummy time, I'd be okay, so we're going to do 10 minutes of tummy time right now. And then, just very from a very analytical perspective. So yeah, that was pretty much it. And then I think it was 2 months postpartum when I looked over at my husband when we were in bed one day and I was if a plane crashed into our house right now and we all died, that wouldn't be so bad. He was you probably need to talk. And I was
this is our sign.
Yeah, this is probably, I was having intrusive thoughts that I didn't necessarily recognize as intrusive thoughts, but it was making it challenging to just essentially exist, walking down the sidewalk with my stroller and be okay, if a car came and hit us right now, what would that look like? What if a car jumped the curb and came and killed us all? What would people say in my field? Just started spiraling, So thankfully, and not everybody has this resource and not everybody even is attuned to postpartum mood disorders. I was oh, I am bad. This is not great. This is not great. I need to reach out for help. I was sobbing at work one day because I hadn't slept. Oh my gosh. And so I had reached out to my friend who's also a midwife, and I was like, hey, this is what's going on. And she was like, first and foremost, let's get you in some therapy, like some postpartum therapy. And then let's get you on some meds because we need to kind of get this under control. So she prescribed me Zoloft, which is game changer, that I'm still taking with this pregnancy. I actually tried to get off of it right before I found out I was pregnant, and I was like, okay, this is not going to end well. And then ended up doing some pretty intense therapy with a postpartum specialist in postpartum mood disorders, which was incredibly helpful because most of my therapy was me grieving, especially those first 3 months of not feeling present and feeling like I missed out on my baby's first 3 months of life. And she just kind of helped counsel me through that. And, it's okay. Like, it's okay to be sad about it. That is, very upsetting. So let's just fingers crossed that doesn't happen this time.
Oh my goodness. Well, first of all, I just want to thank you for just sharing that, because I know that a lot of times when we revisit really painful experiences like that, it's not easy and we can kind of get triggered and we feel all of these things rushing back. And it sounds like you have done an incredible job with your healing and getting the right people involved. And thank goodness that you were educated on what to look for PMADs, perinatal mood and anxiety disorders. That's one of the biggest things that I advocate for with parents that I'm working with is know the symptoms, know what is not normal for you, and what also to look for in a more generalized situation with these kind of mood and anxiety disorders, and then create a plan around that. And this is something that you've got covered really well, but just for listeners, something that I highly recommend doing is, getting the education and understanding that, and then also work with your insurance company before birth to understand your health coverage when it comes to behavioral health and mental health support. Because so often people who end up having a PMAD disorder, they can't advocate for themselves at that point. I mean, Lauren, you're an incredibly strong person. You have this background in labor and delivery, and you understand all of these things. You have those connections in place through your work. All of these things were a beautiful scenario to get you the help you needed. And many people don't have that, like you said, and so knowing, okay, who's within my network who could support me, and finding, I love what you said, finding somebody who is a specialist in the perinatal mental health realm, because there can be wonderful therapists out there who have no idea how different of a population birthing people and postpartum people and all of those things that have gone through this process are. And we need different things sometimes and different support. And so that is amazing. And I think it's so important to do that ahead of time and create that as a part of your plan, and have the person's name and information written down, and research if they currently are accepting patients. And if they are or aren't or could be booked by the time you deliver, have 2 or 3 more people that you really think you might resonate with, because sometimes it's not a good fit the first time we find a therapist, and that's okay too. And I don't want that to be a discouraging thing where people just say, I give up, this didn't work, and then they suffer, So all that to say, first of all, wow. I mean, it's such an incredible journey that you've gone through, a very difficult journey. And I'm just so happy that you're here with us today, because there are many places where that might not have happened. And so I'm so thankful for the care you did receive, and for you to be here and willing to share your story, because I think it's so important that we hear that these things happen, and that there are ways to get well. But also let's be a little proactive about it too, and how we can do that.
Totally.
So there's so much here in your story too, that I kind of have been jotting down things that really stood out to me, and that I think could be really helpful for planning for this pregnancy and postpartum. And one of the things that really kind of resonated with me at the beginning was just kind of this theme of control that you had at the beginning. And really, I want to destigmatize that that's a bad thing, because so many people are like, oh, I should, and I think you're very passionate about this in the work that you're doing, but I should just follow what my healthcare team is telling me to do, and let me just quiet my own sense of need for control or need for being heard or seen or validated. And so I think, at the beginning, you were really showing a lot of that, like, okay, I know what I'm doing here. This is my jam, right? Like, I'm a labor and delivery nurse. I'm going to look at all the readouts and I'm going to like try to be a part of that. And I think that having ways in this next pregnancy where you do have areas where you feel like you're in control can be really, really helpful. And that might look different in different ways, but I know offline we talked about your choosing where you're delivering and who your birth team is has changed. And I think that piece is a beautiful example of that control. Like,
Correct.
This did not go well for me, so I'm not doing that again, right? Like,
Yeah, exactly.
I know what I want and how I can get it. And so I think that is a great start. You've done a lot of great work already there with that piece of knowing who you want to be on your support team and figuring out how you want your birth to look like this time around with as much as you can, because birth happens in its own way. You know way more than I do about that. You witness this every day. But I just wanted to really say, like, I feel like that's a great start, and maybe another area where you don't become so grasping for it once baby's here with like researching for hours and doing all these things, right? Finding those pieces of control in the plan that you create can really help focus that energy and really help you feel like, okay, this is who I'm going to ask for help with lactation support, and having that information readily available. And this is what I'm going to do when it comes to sleep schedule or wake windows or whatever that might look like. Like, I'm not going to turn on the computer and look at this. I'm going to really, if it sounds like it's really important to you to tune into that intuition. And so you sit there and really say, like, what feels right for me? What feels like but new baby is going to be responsive to, when we're working together and really getting to know one another. But the biggest piece, I guess, to be more succinct, is to really like write down these little pieces of where you can find that control for yourself and honoring that, and not making it a bad thing, because it's not, right? And it can be if we start trying to control everything, right? And we're starting to get into that anxiety side. But I think that that's a really key thing that stood out to me. Does that make sense? That kind of resonating?
Totally. And it's,
okay,
like you said, it's already such a different environment for me now. It's a team that I trust like wholeheartedly. And I think to establishing that trust with, it's such a delicate relationship, the kind of power dichotomy between like a provider and a patient. And it doesn't have to be. It's like, I feel like, and this is like my advice to like first time moms, is like, find somebody who gives you options. Yes, we can do this. This is what we normally do. Here are your options within this. It's very similar to dealing with a toddler. Like, you don't ask like, do you want to go to bed now? You're like, okay, it's time for bed. Do you want to put your jammies on, or do you want me to put your jammies on? It's very similar to that, in that, you like find somebody that you trust, that you still have these control, like, because you want to be in control of your own care. It's still your birth experience that you're carrying with you for the rest of your life. To your provider, it might just be a day, but to you, it's, it sticks with you. And that's something that a lot of people, their birth story like really resonates with them, and their care that they receive postpartum. And already the group that I'm seeing, their postpartum care isn't just like, bye, see you in 6 weeks. It's a 24-hour phone call. It's a 2-day visit, and then an 8 to 10 day visit, and then a 6-week postpartum visit. So yeah,
oh my
finally,
God, I love this. Yay.
Yeah, like actual postpartum care, where my pediatrician cares more about me than my OB does.
Right, exactly.
So yeah, I think I'm finding a really good balance in between like things that I want to control. Like, I want to deliver in spring room, and I want the nitrous. Otherwise, like, I'm going to surrender, because that's what it's about, to what my birth is going to look like. And then just surrender to the postpartum period, where that you're not going to get much sleep, and it's going to be a lot, but that it's something that you just like, okay, this is what it is. And like, we are here and we are in it.
Right. Yeah. I love that. I love that so much. Yeah. And actually that's a good segue, because the other thing that I was really writing with a lot of themes as you were speaking was this exhaustion and lack of sleep. And really, that's one of my favorite places to have people focus in, because sleep is the underlying foundation for so much, including PMAD and having that relapse and really figuring out a sleep plan that isn't like sleep when the baby sleeps, because I mean, that is just like, blah. Thank you. I will get right on that. Right. And it's more of like, where can I build in pockets of rest that are intentional and where I can prioritize rest over anything else, that comes up. And that's a lot of the work that I usually try to do with people, is say, okay, let's sit down and look at what all is on your plate right now. Right. And this is especially important for people, parents like you, Lauren, who already have another little one at home, right? Like that adds a whole nother layer of responsibilities and what's going on in life, and really looking at, okay, this is everything I have. I have this all going on, and I'm just going to brainstorm around, what can I let go of? What can I delegate out? And who, if I am going to delegate, is that going to be to? And figuring out creating that postpartum support village. It's another key pillar that we work on in my programs, so that sleep can be your priority. And I think so often we hear, or we've gone through experiences where we've had zero sleep, like true sleep deprivation. And that is like, it is horrible. Like I went through that with my first as well. And it was like to the point where I was hallucinating, and
Yes.
I was like, this isn't good. Like, no, the walls should not be like raining blood. Like something is going on here, like it was scary. And I'm like, oh my God, and I didn't know what to do. I had no idea. Like, but yes, having a plan around sleep and prioritizing that is going to be a huge thing, I think. And kind of one of the questions I wanted to ask you is, you said, pandemic is a whole nother level, right? I bore my second child during the pandemic as well. So I feel you. It was like, whew, let's never do that again, because that was
never again, please.
on so many levels. Yes. So hopefully this time around, you will maybe be able to have a little bit more of that postpartum village present for you. So I wanted to ask a little bit about that. Like, who so far have you identified as kind of your support people for the immediate postpartum timeframe, and maybe even a little beyond that, once you kind of get your feet underneath you in your home and you've done your majority of your healing and all of that? So is that something you've thought about
Oh my God,
yet?
almost every day.
Yay, good.
I keep seeing this like trend on TikTok too, where it's like the 5-5-5 rule. And
yes.
I'm like,
oh my God, I love the 5-5-5 rule.
I'm like, literally 2 days postpartum, I was like, let's take the dogs on a walk. Let's do this. And I was repainting my bathroom like 2 weeks postpartum, but bad decisions, really bad decisions.
Oh God.
But I was like, I have all this time off. I might as well just like do things.
Yeah.
And this time I'm really going to try to like honor myself and my body and the hard work that it's done by doing, what is it? The first 5 days in bed, the next 5 days on the bed, and then the next 5 days around the bed.
Yes.
So yes, like you said,
that's
going to be very challenging. However, my husband's going to be taking a good chunk of time off once the new baby is here. So he's going to be on Maeve duty. He is on toddler duty. I will be on newborn duty. My mom also is the primary caretaker for Maeve while I'm at work. So I'm going to have her over a lot. Those are, my two primary people as far as like helping with, because it's mostly the toddler that wants to go to the park and doesn't understand why, you're not ready to go to the park. So I'm really going to prioritize me and the baby, like bonding, skin to skin, resting, watching a lot of Netflix while my husband and my mom are with my toddler. Also my house cleaning crew, they're my people.
Yes, I know. Oh, I was going to ask that because that was my next question. Household care.
No.
Where are we at with that?
Yeah, no, that was an established, if I am back to work full time, like we are, and my husband works full time and I work full time and I do 3 12-hour shifts. Like they're long days. I'm not doing anything before after that. So that has been established through our house. So I do laundry, and that's like the extent of what I do on like a daily basis. So that's not even and I'm not even going to be downstairs. I won't even know if it's messy. I will have no idea.
Yes.
That's great.
Yes.
People are going to bring me food.
The postpartum blinders. They're on.
I'm just gonna live in my bed and wash my sheets every once in a while.
That's amazing. Yes. I'm so glad you brought up the 555 rule, because that's something that I definitely try to at least, present to families. Yes, sometimes that can be super, super challenging in certain situations, but I think it's a more doable thing than like the 40-day lie-in. That would be gorgeous if we could do that, if our culture supported that. But it's kind of that little step of, okay, at least we can get in the first 2 weeks of truly just resting and trying to bond with baby and just focusing on your own well-being and really centering that time frame around you, because everything is about the baby.
Yeah.
Everything is about the baby. And it's like, okay, but what about the person who birthed the baby and is expected to take care of the baby? Like, no, we need to be mothering the mother. And I think this is beautiful that you've got kind of these at least 2 really great, plans for, the paternity leave time with your hubby. Having, your mom coming over is amazing. She's already established childcare. Maeve's comfortable with her. You're comfortable with her doing things the way you want her to do them with Maeve, because that's a big thing too, is really feeling that safety and connection with your childcare. So I think that's beautiful. It sounds like if you're going with the 555 rule, then you definitely will be prioritizing that sleep and rest. And something to keep in mind too, when we're talking about sleep, and it kind of segues into kind of the nutrition piece, but they're very much connected. And a lot of people, and you may know this with your background, but a lot of folks don't understand the connection between how we nourish our bodies and how that can affect our sleeping, our hormone balance, our everything. It's one of those foundational cornerstones. And so when you are, really lying in, you're having that 555 rule, and you have a recovery space that support that, including the nutrition piece, where you have readily available snacks that are, we're going to talk about some of these 4 tenets that that we kind of are guiding posts for postpartum nutrition, but that are readily available. So you're not having to go up and down stairs, and you're not having to just, well, I'm going to reach for whatever is like easiest for me to grab. And that's fine. Like every once in a while, we're not here to create food trauma. I hate diet culture, and that's not what we're going to get into with this nutrition stuff we're going to talk about. But it really helps you create that availability and focus on nourishing your body and resting your body. So I think that's great. I just want to make sure before we move on to nutrition that I didn't have anything else that popped out to me. I love that you mentioned that you already know you are going to continue your medication, and you've already been doing that in pregnancy. That is huge. And it's a very personal choice for many people, but given your history, you understand what you need. And so for those folks listening, if you have a history of depression, anxiety, or you've had a PMAD disorder before, this is something that is actually a higher elevated risk for you for any consecutive pregnancies afterward. So it's really important to understand what your red flags are, where, your support is going to be coming from, and having a very open conversation with your healthcare provider about, if you are on medication, if it's the right, thing for you to continue that or not. So I did want to mention that because I thought that was really awesome, and that you are continuing to do that for yourself. Yeah, I think those were my big ones that kind of jumped out at me. But when we think about being present, so really focusing in on what we talked about as far as like nurturing ourselves, prioritizing sleep, understanding our red flags for mental health disorders, all of these things. The kind of next level after, I think about Maslow's hierarchy of need, right? And we really focus on those bottom, like survival, like basic needs, and really making sure those are solid. And then we can start moving up a little bit, right? Where we can start thinking about other things that might help us kind of connect back to our sense of self and who we are as we are learning and unlearning who we were and who we are becoming. And so that's kind of some things that I like to have folks do ahead of time, is really start journaling about what pieces of me do I want to continue carrying into this next postpartum, and that are really supportive of my feeling like myself, right? Like, what are some self-care pieces that I know I can do from my bed, from the 555 thing, right? That still help me feel connected. Is there certain music that you love listening to? You mentioned Netflix, finding those shows that you really just love, right? And that just make you feel like happy and connected. And really just finding ways to nourish that emotional well-being can be really helpful for planning those things out. So how can you work on staying present too? Like what things that you know that you're already doing now or that you want to try doing to help you stay connected in the moment. Some things that I sometimes recommend are like tapping practices to really help feel centered in your body, to overcome those anxiety feelings in the moment. Doesn't work for everybody, isn't a good fit for most people. But that is, one thing you can do. Journaling about your experience, obviously talking to a trusted person about your birth experience is going to be probably super healing for you, because if all goes well and you have this wonderful experience this time around, that's going to be really healing to be able to talk about this birth and coming to terms with your previous birth and really like finding your way with that. So those were just a couple other things I wanted to mention, but I'd love to hear from you. Like, what things are you already doing or that you really are passionate about wanting to continue doing, even if it has to be modified a little bit in the postpartum timeframe? Just ran in, sorry.
It's been my whole day. Don't worry about it.
I know. I'm like, okay, dog.
I really enjoy so we live in Old Town Arvada, which is like right in the center of, it's like a family oriented, but they have fun little things. Yeah. I've really enjoyed taking Maeve to a lot of those. So I definitely want to still, not immediate postpartum, but I want to still continue like going out and doing those things, being active with her. I'm really into reading smut nowadays. So I'm gonna just lay in bed and read my smut.
Love it.
And then other than that, just being able to have my friends and my family around. And I think that was a major thing that really contributed to my postpartum depression with Maeve was just COVID and not being able to see anybody or like, look at how cute my baby is. Like, show off your little baby. Like, oh my God, I made this. But that's probably it for now.
And it doesn't have to be something that you have to like answer, but kind of just reflect on maybe as you're sitting down and you're kind of creating a plan for yourself. That I highly recommend writing your plan down. It's really helpful because you can go back, make revisions, and it doesn't have to be like set in stone, but at least there's a place where you're having all of your thoughts collected, what, you're envisioning for your postpartum experience that you can also share with your postpartum support team too.
Yeah.
How do I want to feel connected to myself and what would that look like? And how would I need your support to make that happen? Right. So, even down to making sure you're showering every day, like we're back down at the bottom, right? Like, or whatever that looks like for you. Maybe that's not something you need, but washing your face or, those little things to make us feel human, and writing that down and having a plan of how can I prioritize that along with prioritizing my sleep so that I feel connected to myself as a human and not just an extension to my baby. Because so often we just feel like we get lost in that, and it's just like, oh, who am I now? What am I doing? Like I'm covered in puke all the time and like
my boobs are leaking and I'm bleeding out.
Exactly. Exactly. So that might be a really helpful exercise, is just kind of sitting down and thinking about how do I feel ways that I'm connected to myself? How do I feel connected to my community, and my friends, and how do I want to incorporate some of that even in the early postpartum? Is it FaceTiming? I mean, like, look at my cute baby, those first 2 weeks, and you're so excited because maybe you don't want visitors. I always highly recommend probably no visitors the first couple of weeks outside of that immediate postpartum support village, because it gives you that chance to rest and you don't have to feel like you have to play hostess to everybody, and but how can you still feel connected to those people who are important to you? So just another little thing you can think about when it comes to really being present and giving yourself a lot of grace. If you're, more than anybody, like motherhood, parenthood is not about like enjoying and savoring every moment. Okay. Can we just get rid of that? Yes. Like it's like
hard.
They're going to be hard, shitty days. Yes, it is. It is like we are responsible for like creating, carrying, birthing, and now raising a whole nother human being. And that takes like so much energy, and so much just like time away from, our own self and like, what do I want? And what am I passionate about still? and being okay with that and saying those things. That's okay to feel that way. Like motherhood doesn't have to be, I always say you don't have to be a martyr to your motherhood. Like let's stop doing that, like it's not healthy and it's not what we really, really want for our kids to see either. Like we want them to see us as people.
Yeah. And we still have, hobbies and interests outside of being a parent.
Yes, exactly. Exactly. Okay, cool. So I want to ask you, how are you feeling about some of the things we talked about? You are like super prepared with a lot of this stuff, but I just think some little things like writing down, like, how do I want to kind of connect with myself in those moments where, hubby can take the baby for a few minutes and I have some time for myself. What would that look like? And, just really kind of knowing your own triggers from your past experience is going to be really important. And probably staying connected with that therapist you worked with might be very helpful. Having them on call, waiting in the rafters if you need them could be super helpful too. But do you have any questions for me, like specifically about kind of things that you've been thinking you want to plan for, or you might want some help kind of brainstorming around?
Nothing that, I'm sure in like 5 minutes I will, but I really like how you said, find like what, because I didn't even think about that, like how you connect to yourself and how, because you just lose like all sense of selfness, you just become this machine that's just like eat, sleep, feed, change dirty diapers, and that's your life. Okay, question. So, yes, I have this newborn, but I also have my toddler. And that, I think a part of it that I'm not super prepared for yet is like the kind of grief that comes with like, yes, I'm excited for this second baby. Like, yes, I'm excited for Maeve to have a sister, but I think there's also some grief in that she's not going to be, my only kid anymore. And then how to like kind of navigate, being able to provide for her when I can't do as much as I, obviously I'm normally doing, while still connecting to myself and taking care of a newborn. I think that's where I'm like,
yeah. How do I fit it all in? Yeah.
Pretty much.
No, I love that question. So like, actually that's another part of my pillars. So relationship support and older children or sibling support is a whole nother pillar that I work with folks on. And so part of that is prepping your toddler for arrival of baby and also nourishing your relationship with Maeve. And so a lot of that, the things that you find, like you're really connecting with her, or she loves to do these certain things with just mommy. And those are like really her things that she loves doing with you. Try to figure out a way where even if it's just for 10 minutes a day, when your hubby is usually, because you said, hubby's going to be on Maeve duty and your mom will be too. Find those 15 minutes each day, if you can, where somebody else has baby or they're napping or sleeping or something, where you can literally just be in Maeve's world. And a lot of the ways that I kind of put it is like, just let her lead, like get down on her level, whichever, or have her come to the room because you want to stay resting. It can't be anything that's like, oh, take me to the park. It doesn't have to be like a trip thing, right? But it could be like she loves to color and do crafts or something with you. What's something that you can adapt that can be on the bed where you guys can sit down together and baby's in another room, and you literally call this Maeve and mommy time. I call it mommy Grayson time with my oldest. And I do it with both my kids now, but I try to have those 15 minutes where it's truly one-on-one, and 15 minutes out of your whole day feels doable, right? Whereas you're like, I'm going to have to spend hours of trying to balance between newborn and Maeve and not have that, guilt and like, I'm not spending enough time. It is incredible with 15 minutes of solid, like just one-on-one time where there is no distractions, no phone, baby is elsewhere. It's like right after a feed or something like that. So, baby's going to be good for at least 15 minutes, right? Fingers crossed, where you can like just be in her world and let her like lead, do the playing, just really like connecting. And that can really, really help nourish that relationship now in pregnancy. So starting to practice that, introduce this concept of mommy Maeve time, and really kind of create a routine around it, because then she'll be looking forward to those things, right? When it comes to baby sister's here and mommy spends all time with baby sister and I'm not getting any of mommy, right? So that's one thing that I did with my own son. It's what it's worked really great with some of my other clients that I've worked with. So that's a really great question. Does that make sense? Like, totally. You might already be doing that. I should have asked if you're already doing that, but that's definitely something that could help.
We're together, like essentially when I'm not working
24 hours.
Yeah.
Right. Yeah.
But yeah. No, that is helpful to like, and it doesn't feel so like big. right? To be like,
Yes.
okay, 15 minutes, you and me, let's go.
Yeah.
That
And it
feels very
definitely,
doable.
yeah. And it's definitely when you feel you can be present. Right. And
Yeah.
so like sometimes, like I'll just give my own personal example. Like when my son's like, I really want to do mommy Grayson time right this minute. And it's like my world's on fire, right? Like I've got like the toddler shoving shit into the like station, the PlayStation, and like things are going crazy. And I'm like, mommy's not going to be very present right now for mommy Grayson time, right? So it can definitely be like at a time where like you're in a good place, you're feeling well, more well rested, you've just had a really good snack for yourself or whatever, and you can truly feel like you're connecting deeply during that time, can be really, really helpful setting that up. So doing that now, and then how that translates into postpartum. Another thing that I like to encourage like second time parents is, really prep Maeve a lot, which you're probably already doing all of this, right? But in certain ways of like, okay, having her feel excited about how she can help with the baby. So brainstorming ideas with her. I know she's still really young. I think she's almost the same age as my kiddo. We were just talking about how we both had COVID babies. So, but enough where she'd be like, you can have helping mommy with bringing baby the diaper, one day baby needs changed, or bringing daddy the diaper or whatever. And that's going to be your big sister job. Finding these big sister jobs can be really helpful, having her feel prepared, as a part of the journey, because it is, it's not just a journey for you and your hubby, obviously, but it's for everybody. And it's a huge life change for her too. So that can always be helpful sometimes, is just finding those ways to involve her with the baby, or when mommy's breastfeeding. And if you want to just come in and get some snuggles because you're missing mommy, of course, something I started very early on with my kids was, mommy has 2 arms, so I can hold baby in one and I can cuddle you with the other. Right. And so when I'm feeling, I still say that sometimes when they're feeling like, you always spend time with him or blah, blah, blah. And I'm like, mommy's got 2 arms, and let's read a book all together, so those little like nuggets that you can kind of make her feel seen, and still connected, and more secure in a really scary, overwhelming, big change, those kind of things can be helpful. So I don't know. Is that helpful? I don't know. Hopefully that was helpful.
Yes.
Okay. Awesome. I think if there was something else too. Have you been involving her a lot in age appropriate way of like kind of what's going on with baby and belly and stuff like that?
I don't know if you're familiar with the app Coconut Baby.
No.
My younger millennial friend turned me onto it. She's almost a Zoomer, but she's a millennial.
Okay.
So it's like, it's just like week by week size, whatever. But there's like taboo ones. And it's like, when I was 6 weeks, it was like, this week your baby's the size of half a Xanax. I'm like, these like funny little things. And obviously we upgraded to the pro one so that, so every week when I turn, like, oh man, do you wanna come see how big the baby is now? And she like looks through all of them. And she's so sweet. She's, she has her own little babies, and I bought her like a little diaper kit, and she's all about putting her babies down, sometimes rather forcefully.
She's doing the best she can, right?
She's just doing her best. That's all we can ask. But yeah, I mean, she's definitely, she knows there's a baby. We kind of talk about what a baby is. The baby's gonna cry. And it's helpful that a lot of my friends have babies under 1 as well. So we kind of, oh, look at this. And if she's like, no, I don't want to, I'm like, okay, great. That's your body, your choice. If you don't want to participate, you don't have to. But I mean, as prepared as you can be when you're 3 and the world revolves around you. Yeah.
Yeah, no, I love that. That's a big piece that you're already doing a great job with, because it helps them feel involved and, understand in their age appropriate way and their level of like, okay, like there's going to be this new thing that's going to show up one day and it's going to be crying a lot. And, just really preparing her for what to expect can be really helpful too, and make it a little bit less of a huge shock,
well, like when
baby comes home.
Being the person that I am, I was like, let's watch some birth videos, Maeve. So we're watching all these like birth videos from a artist that I love here in Denver. Her name is Monet. She does beautiful videos. And they're all like unmedicated, beautiful, either home births or birth center births. And she keeps like, they're so slimy. I'm like, yep, they'll be slimy for a little bit when they come out. But yeah, she anatomically, she's like, the cervix will open and the baby will descend down into the vaginal canal.
She's all teaching people on the playground, like, so yeah, this is what's
here's
your
urethra,
like,
here your labia.
Yeah.
Oh yeah,
Oh
I'm
my
like,
God,
where
I
do
love
babies
that so
come from,
much.
babe? And she's like, the vagina. I'm like, good job. She's prepped.
Love
She
it.
knows.
Oh my gosh. Yes, she knows. You're doing so great. This is awesome. Okay, how are you feeling about like kind of that piece as far as like, I know it's hard and it's going to be day by day, but at least maybe incorporating some of that mommy Maeve time ahead of time, giving a routine around that could be super helpful.
Totally.
And you're doing all the things when it comes to, you know, prepping her ahead of time of what to expect. And, you know, the baby isn't going to be able to play right away. You know, like it's so cute when some older siblings are just like, she's not playing with me.
Play with me.
You know,
Yeah.
and like, yeah, pick up the doll. Like,
It doesn't do anything.
Yeah.
It's okay.
Right, exactly. Oh, okay, great. Okay, are we doing okay on time, Apple? I want to make sure we're not okay.
It's so interesting. It's like, wow, so many good things. I'm really interested in learning more about the nutrition part that you mentioned and all the
Yes.
pictures, so I think you want to get to that. But yeah,
Yes.
we have time. I mean, this conversation is great.
Yay. Okay, awesome. Are you ready to move on to nutrition, Lauren, or did you have
Yeah,
anything
girl,
else
let's
you wanted
get
to?
it.
Okay. All right. I love this. So nutrition, I am very passionate about this. I've kind of mentioned at the beginning, like I am not for creating any sort of like stress or anxiety around eating correctly in postpartum. However, I will say that when we incorporate more of the foods that our postpartum bodies are more apt to be able to digest and really hit on some of the things where we're super depleted from pregnancy and from birth, we see a lot better recovery rates. We see a lot better mental health support, a lot better sleep, and we see just all of these things kind of fall into place. So one of the things I do when I work with my one-on-one clients is I have a full 6-week postpartum nutrition plan. And you don't have to follow this to hit some of these things we're going to talk about. But what I do with that is really hit on these 4 key tenets. And it really addresses these ideas of replenishing our nutrient stores. Not a lot of people understand, and there's still a lot of science and studies coming out about this because there's just not a lot of research about anything when it comes to women's health, really, let's be honest. But the work that they have done, they figured out that, you know, in the early postpartum timeframe, our digestive system, right, is already all wonky because we had a baby shoved up in there, right? And so our body is trying to like settle back in and find its way. Right. And just like kind of get back to the right places. And so we have a lot of shit that goes on, literally, or doesn't come out, right? Because we're really constipated post birth. And that first poop after birth is one of those things like when you're in the mom club, you know, right. You're just like, like, no, this is going to be horrible. So there's things that are going on, right? And there's ways in which we can nourish our bodies to really help kind of ease some of these things and also help us with our healing because our body is so focused. All of our energy is focused on creating the milk if we're choosing to breastfeed. And even if we're not, it's still going to go through that process until we can figure out how to kind of slow that down, right? And so much of our energy needs to go into healing our birthing wounds. And the more interventions, the more birth trauma, the more, right? Is we have more to heal. And so when we can focus on incorporating more of these types of foods we're going to talk about, we have a better chance of giving our body the resources it needs to put, you know, ligaments and muscles back together and really like, you know, help our body recover. So there's 4 main tenets that I teach on for postpartum nutrition. And these have been from a combination of science and what we know about that from the studies we have been able to do, and from just honoring and observing other cultures that have way better postpartum practices than we do. And these are 4 main themes that we see a lot that come out of some of these more traditional cultures who have food ceremonies and food approaches when it comes to postpartum. And the 4 tenets are simple, so few ingredients, and we can start adding more and more as we get further into the postpartum timeframe. But to start out, we really want to just have simple whole ingredient. We want them to be nutrient dense. And this is a pretty big word floating around right now, so you may or may not be familiar with it. But for those folks who aren't, nutrient dense just means that the foods are high in fat, high in protein, and high in minerals and vitamins. And so fat is one of those things where people get a little weird about it, right? They hear fat and instantly we're like almond mom culture, like, oh my God, we can't have fat. We have to have like low fat shit, and like we're just all feeling weird about fat. Luckily, I think that's kind of shifting, but fat is so important in postpartum. It is so important. And that's one of the pieces that we really focus on with the food, is making sure that it is high in good fat as well as in protein, because it helps our body absorb the protein and other different nutrients easier because they're fat soluble vitamins and minerals, right? And so if we have that fat in the stuff we're eating, we're going to actually get more out of those vitamins and minerals and be able to actually be more bioavailable for our body. So simple ingredients, nutrient dense, and then warming practices. So this is another big one from more traditional cultures that we see all around the world. And it's kind of a main theme that keeps arising. Some of it is spiritual in nature. Some of it is truly for digestive purposes. But when we're talking about warming practices, this can be spices that can be more warm. So like cinnamon and things like that, turmeric and those type of spices, but it can also mean literally temperature. So when we consume foods that are warmer, our body doesn't have to do as much work to bring it up to temperature, and we're not like doing all this extra stuff with it before we can start digesting it. So that can help. And then it's just staying comforting, right? So postpartum, we don't feel great. Like we're tired, we're sore, we are like, we need some comfort. And so when we can have things that are warm, that can really help us like get our endorphins going. We can feel happier and we can feel more comforting when we are eating. And that also encourages us to want to eat more. And that's important because although I'm talking about all these things that we want to try to incorporate, the biggest thing is that you're eating enough. And this is a lot of what I see sometimes, is that parents get so involved in baby care that they just forget to eat, right? And that's going to have a lot of different impacts, but eating enough is really the goal. But if we can incorporate some of these things too, you're going to be that much more ahead in your healing process. So the final tenet of postpartum nutrition is eating things that are fully cooked. And this is a big one, and something that I like get frustrated with our dietary recommendations, because so much is just out of date. But a lot of what we're told to eat is low fat, like lean protein, low fat yogurt, like all these things are kind of what our healthcare providers kind of tell us that this is what we should be eating. Salads, smoothies, all of these raw foods, those aren't bad or, evil by any means, but in the postpartum time frame, we're lacking certain enzymes that helps us break down some of these more harder to eat foods. And so when we eat things that are fully cooked, we've already done some of that work for our body. The question I get a lot is, okay, but if you're fully cooking all of your food, aren't you losing some of the nutrients and the minerals? Sometimes, yes, that happens. But if we're focusing in on some of the foods that we're going to kind of talk through, you're consuming everything. So some of the foods that I really like to recommend that hit all four of these tenets are soups, stews, slow cooked meat like roasts. All of these things, when the nutrients and vitamins are cooked and they kind of leach out, they're landing in the broth that you're going to consume anyway. So you're not really losing any of those nutrients or minerals when you're kind of consuming more of these type of foods. I get really excited and I talk fast when it comes to this. So I'm going to just take a breath for a minute and just check in. Does this kind of make sense, or do you have any questions about those kind of four things?
No, totally. And I've had a lot of Hmong patients who they can't, they don't do anything cold. They only do hot.
Yeah.
And it's literally just like chicken, rice, and broth with a few vegetables, like it's essentially like pho.
Yep. Right.
And it's very ingrained. It's very cultural. That's just what you do. And they, I'm like, how's it going? They're like, oh yeah, I healed so quick from that. And I'm like, okay. So this time around, no, I was definitely like, okay, I want to do like a prep party and do like and I'm doing November. So it's like soup season, like lots of soups and stews and have them all prepped. And then it's so easy, especially for like my postpartum village, like Michael and my mom, to throw it in a pot, heat it up, call it a day.
Perfect. I love that. That was going to be my next thing, is these foods can be super easy to prep ahead of time. And that's what you want to do, because you want things to be easy and ready. You're not going to want to cook when you have a baby, no one wants to do that. And a lot of these things too are like super easy to freeze, but also like easy to eat, right? So you can make a big batch and then you can eat off of that for either like you can, depending on how you freeze it, you can eat off of it for a full week, or you can do small batches. Like sometimes I recommend my clients do them in mason jars, or like if they're, plastic conscious, or you can do them in smaller portions of the Ziploc baggies, whatever that is. So you can just take things out, mix and match them as you want. But I love that you're already thinking ahead and having a food prep party, because that's the perfect way to get a lot of stockpiling going on, because that's definitely what you want. Okay. So with that being said, the other food that I highly recommend, and I recommend you drinking this as much as you can during the first couple of weeks, is bone broth. Bone broth is a very nutritious food source that hits all 4 of these things that we talked about. And it also is very hydrating. So a lot of new moms want to hydrate with water. And that's so important. You need to keep up on your water intake, especially if you are a chest feeding parent. You want to make sure that you're staying up on your water. But we also don't want to overdo it, because a lot of times what I see going on with chest feeding parents is they have a lot of questions around supply, which is a whole nother thing. But they're just chugging water, right? Like left and right, chugging. And then they're having an electrolyte problem. And so bone broth can really help with that, because it has so many electrolytes and minerals and things that can help replenish that for you and keep you hydrated. So I love bone broth, and it is so simple to make. I actually have a bone broth recipe that I'm happy to share the link to for this podcast. If that works for you, Apple, because that might be something that people want to try. Okay, great. Yeah. And it's really easy. And I actually have 2 different versions, one where you can make on the stovetop, and then one you can actually do in your Instapot, which is my favorite way to do it, because it cuts time significantly. Because the more traditional way is 24 hours simmering on your stovetop. I hate doing that. So I figured out a way to do it in the Instapot, and it like breaks it down to 90 minutes. So it's awesome. So yeah, getting in that bone broth daily can really, really help. I usually say if you can get in about 2 8-ounce cups a day, that's a really good goal to have. And you can freeze them in ice cube trays too, like larger ice cube trays. And that has helped me be able to just like pull out like a glass for myself, at a time. My kids also drink it. It's great for digestive health too, because of those fats and stuff. It can help you with constipation problems. So by drinking that early on, you can hopefully get things moving a little bit easier in your bowels too. So you don't have to really worry so much about constipation problems. Okay. So I have ADHD, and I like when I get like hyper focused, I'm like, blah, 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 blah. So I'm sorry if I'm talking really fast. I better check in with you. How are these all making sense? Are they resonating with you, Lauren? Do you have any questions?
Yeah, no, I love it. And it's, I think it's important to just, even if, these things, to just like iterate it, like, hey, really just, and I think this I was thinking about it when you're talking about it. I think this can be part of like my self-care as well, because food is so important to me. And I just really, food is, And so being like, okay, I'm going to make my absolute favorite recipes for postpartum, stews and things like this, like sweet potato mash, like all this stuff. To just be prepared is kind of like a self-care thing as well. Like, okay, I have this to look forward to today, rather than last time where I was just like, can someone please DoorDash me literally anything, like, not being prepared. So I think it's just a really great like iteration of self-care. Like, hey, pause. It's, it's work up front, but then it's something that helps you to take care of yourself. Because it's true. Like when you have adequate nutrition and nutrition that nourishes your whole body, you feel so much better. And it's just, I think sometimes you get caught up, especially in pregnancy, and everyone's like, just eat whatever you want. You're eating for 2, and you're like, yeah, I will have 4 bowls of ice cream. And the next day you're like, oh, I feel like shit. Why do I feel so bad? You're like, oh, I just gave myself diabetes. That's why. Okay. Okay.
Yes, I love that. Yes, it's so true. Yeah. And while you were talking too, and I love that you mentioned the self-care piece, because as a part of my plan, it's under my physical self-care planning piece, because it's a self-love practice to be able to nourish our bodies in a way that feels good, that is comforting for us, and that just like, food is just life, right? Like food is emotional. And I think that
Yes.
it's often like painted as a bad thing, like emotional eating. No. Like,
No, that's what I
no,
live for.
it's not that. Yeah, exactly. Like it's this connection to, okay, I'm nourishing my body. I feel so good. It like, I just love the way like the soup is just so warm and comforting. It's like a, you know, a hug in a mug. Like they say that sometimes, you know, like it's, and that's how I feel about bone broth too. But also too, like there's some really great healing teas that you can incorporate for keeping yourself nourished as well, and that are very nutrient dense. So some things that you can include are like nettle. Stinging nettle is like a really great herb to incorporate. Also, you can have like, oh my gosh, my brain just went dead with the name, but I have a whole list of teas too that I can also like maybe provide in the notes or something. That might be helpful. But just drinking that in too can also like mix things up from just having water, because that can be super boring when all you're doing is drinking water. So having nice warm teas too can really help as well. And really help your body just flush out what it needs to flush out, and like and incorporate some of those nutrient dense properties too. I had another thought about this that just left my brain, but it was about it'll come to me. Hang on. Oh, intuitive eating. So postpartum is not the time to be worried about the clock when you are nourishing yourself. So this is something that I work a lot with my clients is I don't care if it's 1 a.m. and your stomach is grumbling and you're like, I can't eat right now because it's 1 a.m. and whatever reason like comes into your brain. No, we're screwing that. And we're saying, if I'm hungry, I'm going to eat. So ignore the clock is another really big thing with postpartum. This is your body telling you that it needs more calories. It needs some sustenance, especially if you are chest feeding around the clock. You know, your body's going to need more energy and it's going to need more food. And so those small little meals, snacks, when you are needing them, like really intuitively tap into that and listen to that piece too, can be really super helpful. So then we can kind of avoid the hangry breastfeeding hunger that can sneak up on us.
That is a whole nother demon.
Yes, it really is. Okay, so I covered the 4 tenets of postpartum nutrition and really like how you can incorporate those into what you're already eating. So also this is something too that can be like person dependent, but if you're noticing a lot of stomach upset, or you're noticing a lot of things like gas, constipation, or even diarrhea on the opposite end, really focusing in on what foods are your triggers, and kind of don't make it like a whole thing where you're having to keep a food journal or anything, but just kind of be aware of like what foods you're eating, how that is making your body feel. And that can be really helpful to kind of identifying, okay, you know, like dairy maybe is not sitting well with me right now, and that's okay. So maybe I'll kind of back off of that a little bit. And then we can test it again in a few weeks or whatever, a few days, really just kind of listening and tuning into your body about what foods feel good and you feel well after eating them and what doesn't feel good. Because that can be really helpful too with managing some of those digestive issues that can really make things uncomfortable after birth. So that's another little tip that I like to tell people to do. All right. Do you have any specific questions about nutrition that we could talk about, or anything really that we've talked about?
I guess like speaking mostly as like first a toddler mom and second like the breastfeeding hanger. Snack, like what do you recommend as far as snacks that I can keep like, you know, at my bedside table, just like do a Costco run? Like what do you recommend?
Yes, I love this question. And so I actually have a whole training on some snacks and stuff. I can also give you that link. I don't know if that's helpful. These are all free trainings, so I'm happy to share them, but just some ideas spitballing right here. You want things that are obviously in your room on your table are going to be shelf stable, right? And so when you're looking for those kind of things, again, you want to really look for those nutrient dense options. So nuts are really great. Just being able to have those, you know, eat them a handful at a time. That's easy to do. One of my favorite things to recommend having, and you can buy this ahead of time, are either the tuna packets or the salmon packets. And some people are not fish people, and that's okay. I don't know. Do you have a feeling either way about fish?
Love it. I've been craving salmon this whole pregnancy.
Awesome. Okay, perfect. So those are great because they're shelf stable. They're already pre-portioned, and you can literally just keep them by your bedside table and maybe have some like almond crackers are also really, really nutrient dense as well versus just a regular cracker. Those are fine too. But if you're wanting to get in a little bit more nutrients, I love just being able to scoop that out, and you can do that, you know, almost one-handed if you open that up and, eat that. So that's really good to have on hand. The other things that I like, and this again can also be kind of a taste thing, but nori strip are really, really, those are seaweed strips. Those are really high in iodine. And that's actually something that we really need in postpartum. And they actually give you, and pregnancy is great too, because if you're craving sushi, kind of gives you that sushi flavor if you're missing out on it. So having those, I know I
still
those
eat
at
sushi.
Costco. Okay, yeah, you're like, oh no.
So I have no restrictions. It's fine.
Yeah. So those are really easy too, because they just come in little packages and you can keep that right there and just kind of snack on some of those. And you can get them flavored too. Like I like the sea salt ones. So if you're really craving like some salt, that's a nice little snack you can have. So the almond flour crackers, the salmon or tuna packet, things like you could cut up ahead of time, like avocado that, in the morning you could just kind of cut up and then keep it together. And then when you're ready to eat, it's on a half shell and you can just eat it. That's really easy. And you're getting really good fat from that avocado. So that can help with prolonging your hunger, and just really keep you satisfied a little bit longer. Let me think of some other ones that I've talked about before. Mama Chia packets. So they're like a squeezy pouch. Those are really great. Chia seeds can be super helpful as long as they're soaked and rinsed. So if you're using ones that you just get in a bag, you're always going to want to make sure you soak them before you consume them. But those packets are already done for you. And so that can be a really great source of fiber, also fat as well, all the things that are great for your brain and for your gut. So those are really easy to keep on hand too. Room temperature fruit is great too, that you can just keep, available to snack on. Nut butters are great. You can also have that on like toast, or I love sourdough is a great thing to incorporate too. It's easier for your body to digest. And if you like sourdough, some people don't like it, but I love sourdough. But having that with like some nut butter or even smashing your avocado onto that can be really easy. So those are just a few ideas of things that you don't have to refrigerate. And then you can have all the other stuff too, where your support team should be bringing you your food in bed for your meals and just keeping you up, on your water. Having a water bottle like this can be really helpful. Then you don't have to go and keep filling your cup up. Or with my son, I had like a water dispenser that I would just fill, pre-portioned for how much water I knew I needed for the day based on my weight and all of the things. You don't need to be drinking a gallon of water. Please stop doing that if you're doing that. Anybody listening, if you feel like you are thirsty, quench your thirst. That's really how you kind of follow your water cues there. But having that dispenser is great because then you can kind of visualize how I've been doing on my water, and you can put lemons in there or mint or cucumbers and flavor it too, which is nice. Keeps you motivated to keep drinking. So that's what I got for you for snacks. I know I have more, so I'll send that snack list too, and that'll be helpful.
Perfect. Yeah, it's like things, like not, but like all the other stuff. I'm like, I would have never thought of that.
Yeah. Okay, good. Yay. Awesome. Well, how are you feeling? I just want to check in. Do you feel like you've got some ideas on how you can start moving forward on at least these two topics? I know there's so much more that goes into planning, and I'd love to be able to just work with you on all the other things that you need help with. So my DMs are always open, or we can set up a separate time. But I know that these were the two ones that you really wanted to focus in on. But do you feel like you got what you needed from this session?
Absolutely. Like even just being able to like talk through it and be like, this is it. And then you're like, well, let's go down this path. Like the journaling, I think is really important, especially like #pregnancy brain. It's a real thing. And you're just like, there was a thing that I wanted.
Yes.
And I couldn't tell you what it is now. But I think that's going to be super important, just being able to like concentrate and then like coming back to that mindfulness of like, this is really what I want to focus on. And it also plays into the self-care role. Like this is how I'm taking time, pregnancy and postpartum, of checking in with myself and being like, you good? Be like, yeah, I'm okay. Or like, nah, I remember how you wanted to honor yourself with this and this and this. Like that's a good thing. So I like the journaling aspect for sure. I think that's something that I'm gonna definitely start incorporating.
Yeah. And that reminds me too, something that I do myself and then I recommend too is like, if you're a person who has like a lot, if you're a parent, this probably is everybody, but you have a lot of racing thoughts at night that are keeping you from being able to rest really well, or you're just like, oh, I don't want to forget. Brain dump before bed. Like it is so helpful. It has changed so much for me since I've been doing that. because I would just lay there and just like ruminate on all the things that I didn't get done or that I wanted to get done and blah, blah, blah. This can be helpful for anybody really, but especially if you don't want to be, you know, wasting your time and your precious brain cells that, like you said, mommy brain is hard enough, like put that somewhere where you can just like set it aside. Can be really helpful too. Which you're probably already doing that, but just wanted to share that that's helpful for me.
Always a good reminder to practice a little self-care.
Yes,
Yeah,
for sure.
for sure.
Awesome. Well, I'm glad this was helpful. Do you have anything else that you wanted to ask me while we're here or pick my brain on or anything?
Nothing that I can think of right now, but don't worry. Like an hour from now, I'll be like, yes. So I have lots of things.
We need to do another one of this.
Yeah, let's do a follow-up.
Yeah, I know.
We're like, okay, so what have you actually implemented, and like, what are your goals in the future?
Yes. And that's why I love my programs, because it is that, like, the planning is so important. And that's just the first step, you know. It's like having that person to check in and be like, okay, remember when we talked about XYZ for your self-care plan? Like, this isn't to create guilt or that I'm holding you accountable. It's really just a check-in. Like, how are those going? You know, like, is this even resonating with you anymore? Do we need to tweak it and be like, okay, I don't even care about that stuff anymore. Like, this is what I want to focus on, and really like figuring out a plan to fit that into your busy mom life and honoring yourself in this process, because it's so important. You are worthy of being nourished and honored and supported just as much as your baby is. So,
well, and I think it's like a good, like, you know, the thought just totally left my brain.
It's contagious, I swear.
Oh my God. Yeah. Oh, good. I can't. Yep.
It'll be back in an hour, and then you'll text me like, oh yeah, I remember that.
I remember.
Yeah.
Oh yeah. So it's like, you know, you got enough stuff going on, especially like I work full time. I have a toddler. I'm pregnant, all the things. And it's so nice to have somebody else do the work for you instead of like, you're like, I literally don't have time in the day to like sit down, or it feels so big and overwhelming that you're just like, I don't even know where to begin. Like, I'm so stressed out about this. And then it just creates like more of a stressful environment. So it's so nice to have somebody be like, let's gently and calmly talk you through this process. And I have like points that I'll help you on so you don't feel like things are as big or overwhelming, so that, you know, you kind of like pick at it little by little. So that way, when it comes time, you're like, okay, I know that things aren't, you know, they're children and they still have their own agendas and it's whatever. But at least I have like these fail safes in place for if I'm like, default back to like, what did Jessi say? Like, let's just.
I love that. Yes. Yeah. It's definitely a process. And for anybody listening, like, don't try to just think like, okay, I have to get it all done at once. Like Lauren said, little bits of time. When you have that inspiration, or you feel like you have that really clear moment of thought, like, I loved what she said, like, write it down, journal it, or use your phone. Do a voice app. I love voice app. I use that all the time when I have something I need to remember. And that can be helpful too. And, you know, just take it one day at a time. But if you approach it from pregnancy, your postpartum is going to go so much smoother. Nobody has time to sit and think about it when they have the newborn. Like, don't wait, like, do it now. So if you're hearing this, also know it's not too late to prioritize yourself, but it is a hell of a lot easier if you do it in pregnancy and come up with a plan now.
Awesome. Well, Lauren and Jessi, thank you so much for taking the time, for sharing all of this so openly. I think it's going to help so many people. And I know we could talk for hours and hours, but I think it's been more than an hour at this point.
Oh, wow.
So it's definitely going to be a super interesting episode. And just to close it off, I like to ask all of my guests this really like rapid fire question, but to both of you. If you had a brand new parent, like, you know, standing right in front of you, what are like the top 3 tips or pieces of advice that you would give them, without going too much into details, but like, you know, like 3 mantras to live by or something like that. And I can let both of you answer, because you might have very different answers, or same answers, but we'll see. What would you say? If you only have 2, that's fine as well. Like, it's just how I like to close off the episode.
Yeah, I love that. Do you want to go first, Lauren, or do you want me to?
I think I got some. Okay.
Go, girl.
My first one is this is temporary. Just if it's a bad time, this is temporary. My second one is probably just, especially everyone comes at you with so much advice and they mean well. Just take what serves you and take what serves your family and just leave the rest. And then third, I'd say like, don't be afraid to reach out to your people. You have a tribe, they're going through it. They've been through it. Even if you feel like it's super alienating, like we've been there and we are happy to talk to you about it. You don't have to go through this alone.
Oh my gosh, I love all three of those. Those were so good.
That's why you go first, man. That's why you go first.
I know. I'm like, she stole my "this too shall pass" because that was going to be one of my. But it's so true. Like, it needs to be reiterated. Like, it is hard, and it is valid to feel like it's hard. But just know, like, it is temporary, like Lauren said. The other two that I would probably say just kind of ties back to what we've talked about. Like, definitely plan for your postpartum like you do your birth. Don't just put all your time and energy and intention into birth planning. You need to, and that needs its own intention and planning and being very thoughtful about it. But don't just stop there, because I always tell people birth is just the beginning. And by having that mindset, you're going to have a much smoother transition into your parenthood and the years after. So definitely focus in on that. And then the last thing that I'll say is just, again, you don't have to be a martyr to your motherhood. You don't have to sacrifice everything that you are for your kids and for what you think the ideal parenthood should be. A nourished and I don't know, supported parent is going to be a nourished and supported family overall. And that's going to move mountains in our communities. It's a ripple effect. So take care of yourself, let others take care of you. It's a season of receiving, and please keep that in mind for sure.
Awesome. These are amazing tips. And I hope people will, find some comfort in those and in everything else you shared. Last question, where can people find you if they want to connect with you? Jessi, if they want to work with you on a one-on-one basis, what's the best way to reach out and to just...
Yeah, for sure. So I'm very active on social media. I'm over on Instagram as empowering_postpartum. My website is www.empoweringpostpartum.com. And my inbox is always open. So I love to be able to chat with you either through the DMs or we can set up a call. I can also give you that link directly to my calendar where we can sit down and just talk heart to heart, face to face. Let me know what's going on, and we can see if working together would fit you best and how I can help you. I do have a couple different programs and things. So I really like to have those combos with people and figure out how I can best serve you. So I'm looking forward to connecting with everybody. And I have a lot of free helpful workshops and trainings as well on my social media. So definitely check that out too.
Yeah, that's true. Super generous. That's amazing. Well, thank you so much. I don't know, Lauren, if you want to share some social media handles as well to follow you or to connect with you. You don't have to.
I'm real boring on social media. Don't do it. Just follow my birth center, Seasons Birth Center. Follow them. They're way more interesting than me.
Okay, awesome. Well, thank you so much for taking the time. This was such an insightful conversation. And I was thinking this whole time we should do a part 2 once you have the baby to see, like, if you were able to implement the things.
Yes, I love that.
If you still want to do it, but that could be really fun. In the meantime, thank you so much for being here today. Really, really appreciate your time, your openness and your energy. And talk to you soon.
Yeah, thanks so much for having us.
Thank you.